Hello, my name is Yelda Sarıkaya. I will talk about nursing sciences questions. Firstly, I will show you a video about nursing sciences. Okay, now I will present my presentation. Okay, now what is nursing sciences? Nursing science is the development of theories and practical concepts for improving how clinicians and patients administer care and manage conditions. It merges the world of natural, applied, and human science into a multidimensional lens that explores new and better ways to deliver health services. Question 1. On the second floor of the hospital, there is a fire in the corridor. The corridor has openings to 10 rooms, 4 of which have clients on the life support. The oxygen should ideally be turned off immediately. How should the nurse proceed? A. Maintain respiratory status using the standard life support paraphernalia while moving the patients away from the fire. B. Take the patients off life support and tend to other patients. Leave the patient as they are and tend to other patients. D. Maintain respiratory status manually using an ambu bag while moving away from the fire. Answer is D. Explanation is in the event of fire, if a client is on life support, maintain respiratory status manually with an ambu bag, resuscitation bag, until the client is moved away from the threat of the fire and can be placed back on the life support. Question 2. Healthcare workers are constantly at risk of injury while recovering and moving patients. Which of the following should the worker do to avoid injury? A. Relax abdominal muscles and tuck the pelvis. B. Keep the weight to be lifted as far from the body as possible. C. Maintain the trunk erect, knees bent. D. Straighten knees. Answer is C. Explanation: in order to prevent injury, the healthcare worker should keep the weight close to the body and maintain the trunk erect and knees bent to ensure that multiple muscle groups work together in a coordinated manner. Question: In the event of a fire in the hospital corridor, the nurse should follow which order to properly use a fire extinguisher. A. Pull the pin, squeeze the handle, aim at the base of the fire, sweep from side to side. B. Pull the pin, aim at the top of the fire, squeeze the handle, sweep from side to side. C. Pull the pin, aim at the base of the fire, squeeze the handle, sweep from side to side. D. Squeeze the handle, pull the pin, aim at the base of the fire, sweep from side to side. Answer is C. Explanation: remember the mnemonic paths to precise the use of the fire extinguisher: pull, aim, squeeze, sweep. Question 4. An 81 years old man comes in complaining of dementia. Due to his age, the client is at an increased risk of accidents. Which of the following precautions is incorrect? A. Alert at the nursing station about the risk of falling. B. Keep the bed at the high position to ensure that clients cannot come off bed. C. Eliminate clutter and obstacles from the client's room. D. Instruct the clients to use the call bell system. Answer is B. Explanation: the bed should be kept in a low position with the rails adjusted to decrease chance of the fall from a higher point. Question 5. A patient suddenly lights a cigarette in a room with an oxygen tank. There is a small leak in the tube and the bed begins to catch fire. Which of the following is the correct order of approaching the situation? A. Rescue the patients, confine the fire, sound the alarm, extinguish the fire. B. Rescue the patients, sound the alarm, confine the fire, extinguish the fire. C. Confine the fire, rescue the patients, extinguish the fire, sound the fire. Sound the alarm. D. Sound the alarm, confine the fire, extinguish the fire, rescue the patients. Answer is B. Explanation: remember the mnemonic race to prioritize the event of fire. R is rescue clients in the immediate danger. A is alarm, sound the alarm. C is confine fire by closing all doors, and E is extinguish. Question 6. A patient suffering from cancer has a radioactive implant placed within the tumor in order to deliver radiation therapy. Which of the following is not required while dealing with such a patient? A. Keep all the linen in client's room until the implant is removing. B. Remove all the linen from the client's room until the implant is removed. C. Place the clients in a private room. Use a shielding device such as lead apron. Answer is B. Explanation: all linen food trays should be kept in the room, since the radiation safety is supposed to survey all the materials before they leave the room. Question 7. A 2-year-old girl is brought in after she has ingested some Monopoly houses. What should be the sequence of the intervention? Induce vomiting and call the poison control center. B. Call the poison control center and remove obvious material from the mouth immediately. C. If the victim is unconscious, induce vomiting immediately. D. Call and wait for the poison control center to start intervention. Answer is B. Explanation: vomiting should never be induced. Only obvious material should be removed from the mouth, and the immediate reaction should be to call the poison control center. Question 8. In a hospital, healthcare workers caring for clients suffering from various diseases are at the risk of disease. For this reason, precautions are used. Which of the following diseases is prevented using droplet precautions? A. Diphtheria. B. Chickenpox. C. Tuberculosis. D. Measles. The answer is A. Explanation. Diphtheria is transmitted by droplets through the air. Barrier protection includes assigning the patient a preventarum, wearing a surgical mask when near the patient, and having the patient wear a surgical mask when the patient is to leave room. Question 9. Which action should the nurse take before administering morphine 4.0 mg intravenously to a patient complaining of incisional pain? A. Clarify the order with the prescriber. B. Assess the patient's respiratory status. C. Monitor the patient's heart rate. D. Assess the patient's incision. The answer is B. Explanation. Before administering an opioid analgesic, such as morphine, the nurse should assess the patient's respiratory status because opioid analgesic can cause respiratory depression. It is not necessary to clarify the order because morphine 4 mg IV is an appropriate dose. It is not necessary to monitor patient's heart rate. The last question. The nurse assesses a client's breath sound. A patient with which of the following sounds requires immediate medical attention? A. Crackles. B. Stridor. C. Raunchy. D. Wheezes. The answer is B. Stridor is a sign of respiratory distress, possibly airway obstruction. Crackles and raunchy indicate fluid in the lung. Wheezes are caused by narrowing of the airway. Cracking, raunchy, and wheezes indicate respiratory illness and are potentially serious but don't necessarily indicate respiratory distress that requires immediate medical attention. Thank you for watching. Now we will I will show you code. Please enter the pin. Is everybody okay? Now I will start. Which action should the nurse take when preparing patient's controlled analgesia for a postoperative patient? Evet, answer is A. Second question, which of the following clients will have the most difficult maintaining thermoregulation? Answer is C. D. Sorry. Answer is C. D. Which of the following clients should have an apical pulse taken? Answer is B. Which of the following situations require intrapersonal communication? Positive self-talk. Which change in hygiene practice may be necessary as a patient's age? Bathing every other day, the answer. Parents should give a 2-year-old child whole grapes instead of popcorn for a snack. True or false? False. What can help reduce a patient's anxiety and post-surgical pain? Preoperative teaching, the answer. Older adults have the most difficulty maintaining thermoregulation, true or false? The answer is true. Which disease decrease the metabolic rate? Thyroidism. Which type of cancer has the poorest prognosis? Pancreatic cancer. And the winner. Yes. Congratulations. And we will stop the presentation now. Have a good day, everybody.